As more female physicians enter the workforce, they face persistent challenges that can lead to burnout, including pay inequities, discrimination, and an imbalance between responsibilities at work and home. To tackle those issues, 6 leading healthcare associations, the American Academy of Pediatrics, the American Academy of Family Physicians, the American College of Obstetricians and Gynecologists, the American College of Physicians, the American Hospital Association, and the American Psychiatric Association, funded by a grant from the Physicians Foundation, have formed a partnership that brings together early to mid-career female physicians for networking, mentorship, and leadership training. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly, Senior Writer in AHA's Washington office, and your podcast host. In this podcast, our Vice President of the AHA's Physician Alliance, Elisa Arispacochaga, talks with women's physician leaders who are participating in the Women's Wellness Through Equity and Leadership Grant Program.
Welcome to another in AHA's ongoing series of podcasts where we focus on important issues facing clinical leaders. I'm Elisa Arispacochaga, Vice President of AHA's Physician Alliance, and today we're talking with women physician leaders who are participating in the Women's Wellness Through Equity and Leadership Grant Program. AHA is joined with a consortium of 6 organizations, including the American Academy of Pediatrics, the Academy of Family Physicians, American College of Physicians, the American College of Obstetricians and Gynecologists, and the American Psychological Association to develop a program to address wellness and leadership needs for women physician leaders over the next 18 months. Joining me today is Dr. Amy Ahasic, Section Chief, Pulmonary and Critical Care Medicine at Norwalk Hospital, part of the Western Connecticut Health Network in Norwalk, Connecticut, who was nominated by AHA to participate in this program. So welcome and thanks for talking with me today.
Thank you.
So to get us started, why don't you tell me a little bit about yourself and your role in your organization?
Thanks so much for having me. I am a pulmonary and critical care physician. As you mentioned, I'm at Norwalk Hospital, and we are a roughly 300-bed community-based teaching hospital in southwestern Connecticut. And we are part of the Western Connecticut Health Network, which includes 2 hospitals to our north, Danbury and New Milford Hospital. And the network is a branch campus of the University of Vermont Medical School, so we host many of their medical students. And Norwalk itself is affiliated with the Yale School of Medicine through our pulmonary fellowship program. So we have a lot of affiliations through the local academic community. I'm also a mom. I have a first grader and a 2-year-old, and I'm married to a guy who I'm very happy is not a physician. He actually runs his own aviation consulting business, so we have a little bit of balance in the house.
Oh, that's wonderful to hear. So tell me a little bit about what drew you to medicine and then subsequently to really pursue that leadership role at your hospital outside of treating your patients.
Yeah, it's funny. I was trying to think back when I first had an interest in medicine, and it's hard to pinpoint. I just know it happened very early because I remember playing with Barbies, which I really enjoyed, and I would make Milwaukee scoliosis braces for Barbie with paper clips and rubber bands, and I would cast the Barbies using little pieces of toilet paper that I would wrap and get a little bit wet and then put on the air vents in the house, and they would dry, and actually worked really well. But probably more pivotal than that were other experiences like having my dad develop a serious illness when I was in elementary school, and he ended up in an ICU for a month. And now I kind of understand what had happened at the time, but it was scary, and luckily he fully recovered. But then in high school, I became a patient myself and ended up requiring a few surgeries between senior year in high school through the summer after my freshman year in college. And so it was really those personal experiences that I think were pivotal. And I didn't really have any doctors in my family, so it was really those clinical aspects of medicine or understanding disease, taking care of patients that drew me to medicine. But then I ended up training in some highly academic programs like Yale and Harvard, and I ended up with a research pathway. I ended up doing clinical and translational research out of fellowship. I had a mentored research grant as a junior faculty at Yale, and I worked really hard to build a critical care research program there, including with a lot of help from one of my friends and mentors, Dr. Margaret Pisani. But as time went on, I really realized that although I liked the research a lot, I really enjoyed building that program and trying to create something that was going to live on for the faculty of the section much more than I really enjoyed writing grants or looking for the next funding source. And I didn't really feel as a faculty that I really had a voice or a seat at the table to influence more of the path of our section or our department or the hospital or the medical school. And that kind of left a gap in my professional satisfaction. So when the opportunity arose to take my current position at Norwalk, it really seemed like a great time to sort of shift my career. And right now, I get to do clinical care still. I teach fellows and residents and medical students every day. But I also get that chance to shape the current and the future of our section and our role in the hospital and have a voice within the hospital and the medical group. So now I get to do a little bit of everything, and I think that's been much more professionally satisfying.
So how would you describe your leadership style? You mentioned your mentor who played an influential role in sort of defining some of your work, but were there some specific experiences that you can share that really helped shape that leadership style?
Yeah, I would say Dr. Pisani is one of many women who I think have been wonderful influences on me. I think I've been lucky not to have any one singular influential mentor, but a lot of people, particularly women, who've really shown by example in how to be successful women and leaders, physicians, moms. I really hate the concept of work-life balance. I think it implies some sort of utopia where we do it all every day, and that do-it-all phrase I find challenging to live up to, and I don't really think it's realistic or healthy to teach that to young female physicians as the thing that they need to live up to. And one of my friends, Dr. Esther Chu, who is an emergency physician at Oregon Health Sciences, she recently gave an interview where she had talked about something one of her mentors taught her, which was to think about it more like a pendulum, swinging more on some days or moments toward work and other days more toward family or home responsibilities, but really that it's constantly moving and shifting. And I think that is really a better image and captures our lives much better. And thinking about other experiences, I really think my year as a chief resident in internal medicine was particularly influential and formative. I think it was the first time where I really realized that others saw me as a leader, which made me realize I could see myself in that way, in a way that I hadn't necessarily seen myself before. And it also gave me an opportunity to experience non-clinical roles, which I really hadn't had the chance to do before that point, even being a manager or really more of a middle manager and dealing with personnel issues and morale and the wellness of the trainees. It happened to be the first year of the 80-hour work week, so it was a particularly challenging year. But we really had a lot of input as chief residents, and we got to also get a glimpse at the business side of medicine and participating in budget meetings and departmental meetings and things like that. And I think that was something I missed after my chief year from then on. And you asked about the leadership style. I think I would say that I rely heavily on my emotional intelligence. I think part of that is really having a strong sense of self-awareness, which certainly includes knowing my weaknesses, and I have several. But I think being in my current leadership position has really pushed me to try to develop a wider array of leadership styles or skills for different situations. And I think I appreciate more than ever that versatility in that sense is a really important quality of an effective leader. So that's something I think I will continue to work on.
Oh, that's great. I think that's one of the most important traits, the ability to be flexible.
Yeah.
So with the increasing numbers of women entering medicine, and I believe we're at a point where 2 or 3 years ago we hit the point where there are more women enrolled in medical school than men, what do you think are the things that we need to address for the profession sooner versus later?
Yeah, and it's interesting because I think my year of medical school, our class was the first that had more women than men for that school. And that trend, it's great to see that continuing. And I think it's great for our field and great for our patients how many women are entering medicine. But I do think that the culture of medicine has been very slow to change in addressing how we value or maybe devalue female physicians. there's all the little things that all of us female physicians experience all the time, like being introduced by our first names while the male colleague next to us is introduced as doctor, or having patients or family members mistake us for nurses or non-physicians even after introducing ourselves as doctor, or, directing the discussion to the male intern rather than us as the female attending, which just happened to me a couple days ago. And none of that is new, and I think we all have experienced that, but I haven't seen it lessen much in my career thus far, even though now I would think that I have a little more sort of authority by age, so to speak. But, I think there are much bigger systemic issues, and we still have plenty of data to show that there are ongoing significant pay inequities for women in medicine, even when you account for part-time schedules and leave taken for childbirth. And the number of women in senior academic positions like full professors and deans is still very disproportionately low. And in my personal experience, I think maternity and breastfeeding discrimination is still widespread. And I think these are really critical inequities to acknowledge and address because they really do directly impact the wellness of female physicians. And female physicians may suffer as much as double the rate of burnout as their male colleagues, and some of these things may be part of why. I think that hospitals and medical schools also really need to do far better at addressing these inequities at more of an institutional or organizational level rather than at the level of the individual physician. That's something that I think is really well discussed in the perspective piece from the New England Journal last September on whether time's up in medicine. My friend Dr. Chu, who I mentioned earlier, is one of the authors on that piece. And I think it's a very nice summary of some of the ongoing issues we continue to face. But as many things, I think awareness and conversation about these issues are the first steps.
Absolutely. And we're hoping through this program we'll continue to bring that conversation forward.
Yeah, absolutely.
And I know in your involvement in the WEL program, you've developed an interest in the leadership training as a unique tool to prevent burnout among women physicians. Can you talk a little bit about your goals and how your own strategies for preventing burnout and maintaining your own well-being influence this?
Yeah, in our first meeting for the WEL program, we explored a lot of facets of what are unique challenges for women in leadership positions, which was honestly a perspective on leadership development that I had never experienced before. And I think I had a bit of an epiphany about my lack of recognition that I was experiencing some symptoms of burnout, specifically in the emotional exhaustion realm. The feeling drained or having difficulty recharging or having a hard time feeling like I could unplug from work. And it was actually pretty emotional to realize that I was paying so much more attention to everyone else's wellness than to my own. And that really stuck with me. So since then, I've been doing quite a bit of reading and try to educate myself about gender disparities in physician burnout. And what I learned is that this emotional exhaustion facet of burnout is particularly common in women and often the first sign of burnout. And I was surprised to learn that women physicians have much higher suicide rates than the general population. And that was quite sobering to me. And I think there's also a concept outside of medicine of this invisible workload of motherhood that really resonates with me, this kind of concept that moms in particular tend to take on a disproportionate amount of work, often cognitive work, in keeping the home and the family running, like remembering to send back that field trip form or that the library books are due or there's no clean jammies for the toddler, so you have to start the laundry when you get home, stuff like that I think we're constantly thinking of. Mm-hmm. And I say this as somebody who has an incredibly supportive husband who's actually shifted his own career to allow for more time at home for him to help with the house. But, there's still these imbalances that exist. And I think those really do contribute to that sense of emotional exhaustion. And I know for myself, I'm certainly still a work in progress, but I definitely have been giving more attention to consciously unplugging from work in the evenings or on the weekends, trying to find the things that refuel me, whether it's just cooking a meal or going for a walk or meditating. But in thinking about how we might address the wellness of women physicians, both locally and beyond, I think one of the steps to start with might just be better education for women about the gender disparities in the rates of burnout, how burnout might manifest differently in men and women. And through my experience with WEL, I definitely have a new appreciation for leadership development opportunities specifically focused on the challenges women face as opposed to general leadership development, and I am finding it really useful to myself. I think the other thing is that I've become really interested in the concept of a chief wellness officer. Mm-hmm. So my organization does not have one of those, and I don't think it's a panacea, but I'm fascinated by the concept of giving C-suite stature to wellness, which I think automatically really prioritizes wellness as something that an organization cares about. And I think that could be something that plays an important role in improving physician engagement and morale and addressing the sources and symptoms of burnout. So right now I have lots of ideas and I'm still learning, but I think over the coming year, my first step is to build a network of women physicians and physician leaders within my own organization to identify our needs for wellness and how we can prevent burnout locally.
Wonderful. This reminds me a little bit about when they came out with some of the first studies looking at the very different sets of symptoms for women having heart attacks compared to the accepted.
Yeah, exactly.
Understanding that, well, if you're having a heart attack, your left arm should hurt, which it turns out isn't the case for most women. So yeah. I'm glad we're able to participate in this program and really start to understand what are those things that we need to be looking for.
Yeah.
So to end on a little bit more of a upbeat note, tell me a little bit about what makes you hopeful for the future of medicine.
Yeah, so much. I mean, it is a really scary time to be in medicine in a lot of ways. It feels like everything's always changing, how we deliver healthcare, the fiscal uncertainties that, so many organizations are facing, always more patients in need. But, despite this, there's so many exciting advances being made all the time that are improving the lives of our patients and the care that we can provide to them. And, if I ever need a dose of hope, I just look at our trainees. Working with fellows and residents and medical students is truly the best part of my job. And I just see excitement and passion in them that's not yet been lost. And it reminds me of how I felt when I was a trainee. And I don't think I will ever lose the desire to try to improve the quality of people's lives either, or in my line of work, sometimes it's the quality of the end of their lives. So that really does keep me going, and I'm very hopeful about the future of medicine.
Well, that's wonderful to hear. Well, thank you for joining us, and I really wish you the best of luck with the program and look forward to hearing the results.
Thank you.